Life Audio.
Welcome to Christian Natural Health with naturopathic Dr. Lauren DeVille. Christian Natural Health is the podcast on how to get and stay healthy, God's way. You'll hear topics on nutrition, exercise, sleep, avoiding toxicity, meditating on scripture, what supplements to take, stress management, defeating anxiety and worry, how to reconcile Eastern medicine approaches with Christianity, and a whole lot more. Now, here's your host, Dr. Lauren.
Welcome back to another episode of Christian Natural Health. Today, I'm so pleased to have Dr. Connie McReynolds with us. Dr. McReynolds is a licensed psychologist and certified rehabilitation counselor with more than 30 years of experience in the field of rehabilitation counseling and psychology. She is the founder of neurofeedback clinics in Southern California, working with children and adults to reduce or eliminate conditions of ADHD, anger, anxiety, depression, chronic pain, learning problems, and trauma. She recently published the book, Solving the ADHD Riddle, the Real Cause and Lasting Solutions to Your Child's Struggle to Learn. Welcome, Dr. McReynolds. Thanks so much for joining us.
Thank you so much for having me. It's a pleasure to be here today. I look forward to our conversation.
Yeah, me too. So ADHD is like such a trend right now on social media, especially. So tell us a little bit about not just what the symptoms are. I think everybody kind of knows the symptoms for that, but maybe a brief overview there. But then also, what do you find as being some of the most common underlying causes for ADHD and ADD?
I think it's a great starting point because it is a hot topic. I think it's been a topic and it's just getting hotter because I think more and more awareness is being really kind of put toward this difficulty that children are having, and I'll say and adults. And so I've worked with children and adults, both equally affected by some of the symptoms of what we call ADHD, which I think, interestingly, most people have some sense that ADHD is about the little guy who runs around and can't sit still and, squirms in his chair, or, people who can't find things or get disorganized. And those are some of the common aspects. But what I've learned is I can have 10 children walk in to my clinic on a particular day, and all 10 of them are going to have a different combination of struggles that they are experiencing. And within that, I think that's why some of the one-size-fit-all kind of ideas aren't quite fitting very many. Yeah. It just doesn't fit well, is what really started this journey about 15 years ago, was understanding the stories that parents were bringing in. It was like, we've tried all of this. Nothing's had a lasting change, and we don't know what to do. Sure. Our child is struggling. We're struggling. The teachers are struggling. That was the theme. Everyone was struggling, and there didn't appear to be a whole lot of wins that were going on out there. And that's really where this all started.
Yeah, absolutely. And so as you've started to dig, what do you see as being the trend? Like, it seems like this is progressing, right? There's more and more people that are having difficulty than ever before. What do you think the reasons are for that? I'm sure that's a big question, but.
Yes, it is a big question, but an important one, because I think there are many contributing factors. One, I think our awareness certainly has improved from where we were 20 years ago, even 10 years ago. We used to really think, and I think there's a lot of it, so I can't say we used to think this, because I think there's still an awful lot of it, wherein this child is just willfully misbehaving. And I'm here to say, and really I kind of call myself a little bit of a myth buster on that. If children could do better, they would, because they don't want to be in trouble. So first and foremost, and adults the same way. If your spouse could remember the grocery list on the way home,
they would.
They would, because they don't want to catch the wrath when they walk in the door and forgot the milk.
Right.
Let's just get clear. This is not willful bad behavior on anyone's part. And that's really the starting point, I think, for some of the discussion. Also, we really are, I think, unaware of what the underlying root cause is for a lot of the difficulties, which is, again, back to where I started 15 years ago, as I started recognizing there's something else going on here. We call this ADHD, but it also, I'll say, it walked in the door as oppositional defiant disorder. That diagnosis also walked in the door as intermittent explosive disorder. It walks in as trauma. It walks in as anxiety. It walks in with a long, long list of DSM-5 diagnostic categories. And the one thing that I have seen in common when we peel all of those labels back, and I'm not a labels person. I have never been a labels person in 30 years. I'm not that. And so when we peel those labels back and start to look at what is really happening here, we're finding that, in fact, there's something else going on underneath all of these conditions. And that is this thing called auditory and visual processing, which is why I wrote the book. This is the message that I realized we need to start in order to change the narrative about people who are struggling, children who are struggling in school, adults who are struggling. This happens to people in the employment setting. I can't ever remember what my boss says to me, and I'm going to get fired because he's really mad at me, kind of thing. And I've had these are all cases that I've worked with. In cases, I mean clients and people who have shown up, who have these tragic stories so far that just aren't working. I think we have a preponderance of diagnosis of this in our world. I'm not sure that's a bad thing, but I'm also not sure it's a good thing. So I'm kind of in between on that, because I think if it's drawing attention to the struggles that someone is having, that's a good thing. If we just say, oh, they have ADHD, there's nothing they can do about it, or I can't do anything to make this any better, or I'm just going to give up, it's hopeless, I can't change my life, then that's not such a good thing. There's something in between there. And that's where I live, is the in-between phase in here.
Yeah, absolutely. Okay. So if the issue is primarily auditory visual processing, why did that get broken? What's going on there?
I wish I could answer that, because I've had children as young as 3 who come in and we're finding this in them. So clearly they don't have life experiences necessarily that has affected this. However, I will say that we treat a lot of children who've come through foster care, some pretty rough situations. And so obviously trauma is going to have an impact on how I process information in my world. So I can be internally really distracted, and my brain can be kind of hypervigilant because of the trauma, which is going to affect my ability to really be present and take in information. So we set that in the mix. We've got that anxiety, depression, any of those conditions, and children can have some of this as well as adults. So we really want to understand that we don't necessarily at this point know how this has happened, or necessarily if something specific has contributed to it. What we can say is within 20 minutes, we can figure out what it is with a computer-based assessment. 20 minutes.
Gotcha.
I can find it.
So just to speculate a little bit, like, so what I think I understand as far as the neurochemistry to some degree is that there's this disconnect between, what you're going to process in the prefrontal cortex versus the limbic system, where you're kind of overtaken by emotion. Is it like limbic hijacking? Is it kind of that? Is that your theory, or not necessarily?
Well, I think it is for some people, but it isn't for all people. Because we have children and adults who haven't had any of those experiences, who are doing okay in many areas of their life, but they are not doing okay in certain areas of their life. And it becomes a real struggle for them to be able to navigate school or work. And so it isn't just one thing. It is the possibility of many things, and the why or the how is often asked. It's like, well, how did this happen to my child? What did I do wrong? You didn't do anything wrong. No one did anything wrong here in this case. What has happened is these pathways just aren't strong enough. And I equate it to, I'm right-handed. I cannot write left-handed. If something happened to me and I had to start writing left-handed, this is going to be a big struggle. This is not my strength. Is it possible that I could train myself to do this? Well, people have done that all over the world. People have retrained their brain when they've had to. This is similar. We know that training the brain has to do with repetition. So I'm going to have to practice a lot. And I might even need a coach to help me figure out how I'm going to write my letters so I can even sign my name legibly if I'm trying to do it with my left hand. But it doesn't mean it's impossible, but I might have to work at it. So I'm going to have to train my brain to strengthen that particular neuronal pathway in my brain to be able to accomplish this task. But once I've learned it, the good news is my brain's going to hang on to it.
Anchor it. Yeah.
It does. It anchors it, not unlike when we have learned how to ride a bike as a child.
Mm-hmm.
Maybe we haven't been on a bike for a number of years, but we can get back on that bike. We're typically not going to need our training wheels again.
Yeah.
We're going to be able to keep ourselves upright and not run into things, hopefully.
Mm-hmm.
But our brain is going to remember the balancing component that's needed
Yeah.
and the physical maneuvers to move us forward while we're balancing. We remember that the brain retrains it and retains it. So that's the piece. We train these areas that are weaker once we find them. And the good news is with this process of brain training, it tends to hold.
Yeah.
So people don't need to keep coming back for this.
Right. Oh, that's great. So one more thing before I go into the minutia of how you actually do that, simply because from my world, I'm usually looking for, the global underlying cause. So I'm wondering, for those people that don't have a trauma background, and you might not deal with this, and that's fine if you don't, but I'm just curious, to what extent have you seen an association between like gut inflammation and the neurochemistry kind of shifting? Because I've seen that a lot in kids with issues like this, especially where, the gut-brain axis connection. Is that something that you've seen much?
I haven't seen a lot of it, but it doesn't mean it isn't there in a lot of people, causing difficulties. And one of the aspects of the intake is I'm always asking those questions. It's like, what's your sleep? What's your food routine? What are you allergic to? What foods do you not engage in? Are there, tell me the picture there, because I think it's all important.
Sure.
Parents are pretty savvy these days about food sensitivities. And so they will say, and when the child's not in the room, or maybe even there, it's like, oh, well, we've decided our family just doesn't need to, do dairy, or we've decided the family just doesn't need to do gluten, whatever it might be.
Right.
And so that's great, because I know that they've been down that road. They're looking at the full picture.
Sure.
And if someone hasn't done that, then there's a conversation about, well, do you feel sensitivities toward anything? Do you notice anything when you eat certain kinds of foods? Do you notice anything when your child, well, as you happen to mention this, I notice when he eats a box of cookies that it's like, well,
things go a little sideways. Yeah.
Things go a little sideways. It's like, well, okay.
No, that makes sense. So, but it sounds like from what you're doing as far as the auditory visual retraining of the brain, you don't necessarily have to find and deal with root cause from an inflammatory systemic standpoint. It still works, even if you don't go there, right?
It really does. I mean, it does help when parents are really tuned in to the whole aspect. And I do encourage that.
Right.
It's like, no, if we're going to a fast food place for breakfast every morning, maybe we want to rethink, what other options could be available. Could you have something at home made over the weekend? Things like that, which might help a little bit.
Right.
But with the brain training, we're really dealing with tackling those areas that affect the concentration, the focus, the memory. And as we know, food can do all of that, as well as medications.
Sure, yeah.
So sometimes older folks will come in with a long list. I had this happen recently with a gentleman. He'd attached his medical records. I think he came in from the VA. And I was looking through some of the blood work. And first up, I am not a physician. So I'm not going to make recommendations. But, excuse me, they were worried about his memory. And as I was looking through some of the medications that he was taking, I happened to know that some of those can affect memory. And so what I will say to people is you may want to talk to your pharmacist. You may want to go on some reputable websites to just look at, are there any ties to this? Particularly if they've started medication and now they're reporting some of these difficulties. It's like, we may have something here. I'm not sure. It might be worth looking into, though.
Sure.
And having those conversations so that they're informed, but I'm not directing medical care.
Sure.
So,
yeah, absolutely. So, tell us a little bit about how you do the audio visual retraining. This is part of neurofeedback, right? Okay. So tell us, can you define that for our audience, and then tell us how you do it?
Sure. So a lot of people have not heard of the term neurofeedback, even though it has been around for almost 50 years now.
Wow.
So this is not anything new in the world. This was actually developed in the 1970s at UCLA by Dr. Barry Sternman. He was doing some work for NASA at the time. And it has evolved. There's 50 years of research in the literature. Some types of companies like to say it's still experimental. I'm not so sure how experimental it might still be, but it's similar to biofeedback. And so a lot of people have heard the term biofeedback. And biofeedback really began when we started understanding that if we paid attention to our mind-body connection, we actually could affect how our body was functioning. So there were sensors that might have been placed on a finger to measure pulse, maybe measure respiration. It was fed into a unit where the person could see what's happening through data. And then by being coached, they could maybe be coached to relax their muscles, breathe differently, and they could see the pulse rate come down. So that was the long name of that, of course, is biological information feedback. And for convenience became dubbed biofeedback. And so now we fast forward a few years to neurofeedback, which is the same concept. We're measuring an internal process, in this case, brainwaves. So by placing a certain type of sensor on the scalp, we can literally measure your brainwaves. And with that, it's fed into the computer. There's an algorithm running the show on the back end. And for example, if we have a child who's very inattentive, what we will be doing is setting up a training plan that looks like these are low impact video games. So I've warned the kiddos, this is not what you're used to.
Yeah, I bet.
So don't think you're coming in here running Fortnite or whatever.
Yeah, I'm sure.
You might be used to. This is going to be really low impact for you. And there's a reason I tell the parents later, it's like this doesn't dump dopamine into your child's brain.
Exactly.
So by using the brainwave information, it's a one-way system. It's fed into the computer. And if I can see graphs of how my brain is working, so let's say we have a green graph and a blue graph, just for simplicity. We have a lot more than that. But if I'm trying to maintain a state of calmness, I'm going to be measuring some of the theta, which is a calmer brainwave. And it's like, can I make this little chart go up or down by how I'm paying attention to how my brain is operating? The brain will have to learn how to do this. So it's much the same idea as the bike. To learn how to ride the bike, I can tell you how to ride the bike. I can show you how to ride the bike. You have to get on the bike to learn.
Helps.
And it's the same concept here. Your brain will figure this out. So the good news is the brain is really curious and it wants to figure this out. If we can just keep the thinking mind out of the way, primarily with adults, then we can allow the brain to learn its way through this process. And as it's learning, it's training itself. And so it's training itself through the repetition of the programs. And typically it's 20 sessions. And then we're going to come back and rerun those initial assessments because that's the big marker. But we have the markers all the way along. And as my brain gets stronger, the games, we call them, are getting stronger or tougher or more advanced. So my brain is continuing to be challenged through the process until we get to the kind of the area where we run these assessments. Then it's like, wow, your attention's really changed. Look at this. This has really gone up here and your memory has improved. We started out at 42. It's now at 85. That's pretty good. And so they get that kind of feedback as well, but they are receiving feedback all the way through in their sessions and with the clinicians and the like, so that they can see. The thing with this is it's subtle. So there's a cautionary tale to folks and to parents. This is not the same as when you walk into a room and flip on a switch. This is you have a dimmer switch. And so you're just slowly kind of turning this up and strengthening till one day the light's on and you're functioning differently.
Yeah, that's amazing. So 20 sessions over a period of how long did you say? Typically,
there are 30 sessions twice a week, and then we reassess. Most people need 20 hours, which is 40 sessions, but we have the midpoint there where we're reassessing. because then there'll be a different plan created for the next phase of that to wire in and to catch any areas that aren't quite where we want them to be. For the average person, there are some people who actually will get done within the first 10 hours. There are some, if we're dealing with anxiety, trauma, some very significant processing areas of weakness, it can take some time. Sometimes when there isn't any visual processing that we can identify, or there isn't any auditory processing, so those scores are all zero for this child or adult, we're building neuronal pathways in there. So if we're strengthening, that's one time frame typically. If we're building, then it's going to take a little bit longer, because we're literally kind of starting from the baseline on that to get the person to where they want to be.
Yeah. And does the time frame here have anything to do with, like, from the strengthening standpoint? I've heard that creating new habits is anywhere from 21 to 90 days. Does that have anything to do with the time frame that you're talking about?
It has to do with the amount of practice and repetition that's happening. And that's a bit of why that 21-day business is, people get frustrated with that because they don't see the change
that fast.
And it's really about how often were you able to remember to practice this? Like learn how to play the piano or something. I have to be at the piano quite a bit, to do it. So it's really the consistency is what I say. So if someone on their own is really trying to break a bad habit, like not eating that box of cookies, they have to do something else to really either distract themselves or train themselves to like something better. That takes time. And what will happen with these bad habits is that it does prune itself away in the brain. So that's the beauty of this, is I actually have seen these clips of these neuronal connections being made. And then I have seen clips of where these neuronal pathways actually disengage. And so this is where the brain changes in both cases. So we can affect change. And this really is grounded in the scientific knowledge of neuroplasticity, which is our brain is capable of changing all the way through our life. And that actually came out in 1949 by Dr. Donald Hebe, who was a Canadian psychologist. And it's taken a while for it to really get some, footwork in the world.
Yeah, but how encouraging that we're not just doomed to have this diagnosis forever, right? So.
We're not. That's why I call myself a little bit of a myth buster here.
Yeah, that's wonderful. Very cool. So, and are there any other holistic approaches to ADHD, especially that you use adjunctively with this in particular?
Well, certainly the diet and paying attention to that. Monitoring the amount of video time is a big one that we have a conversation about. We've treated children who were seriously addicted to video games to the point that as the parents started to dial back, this child had gone berserk in the house and destroyed areas of the house, destroyed the father's work computer. It can get very, very serious if children are seriously addicted to these dopamine dumps in the brain. And this actually was written about in 1999 with research that was out about the addictive potential of these video games. And I'm thinking that's 25 years ago. And we're still pushing these games out to children.
And games and TikTok and like all these videos that are there.
All of this, it trains the brain. So whenever we watch anything, we're training our brain. And I think parents don't quite, and a lot of us don't quite, I didn't know until I really did a lot of research on it over the last 15 years. Anything we watch is being recorded in the brain. It's there.
Yeah.
And so, they say garbage in, garbage out. And you have to really monitor what your brain is feasting on day to day. And I really talk to parents about that. It's like, get outside. Let's go outside. If you can, cut off the video games and go out in the backyard or go to the park or do something like that where you're getting some physical activity, that's really important. So diet, exercise, sleep is a big piece of this, and as well as hydration. So we talk about, what are you drinking all day long and some of those conversations, but as well as tips for parents and teachers for once we identify what is happening here, how do I interact with my child, the parents and the teachers will say. And so we've got strategies
Sure.
for that while the child is going through, or the adult is going through the process of strengthening those notions. So we really tackle this from many, many angles.
Mm-hmm. And so given all of this, holistic approach, where do you feel like medication for ADHD fits into this, or does it?
Well, it's a very big mixed bag for me. In my book, I'm pretty clear.
Yeah.
So I could write my book and I could say what I needed to there.
Absolutely.
And, it's important to understand that sometimes medication can be helpful.
Mm-hmm.
What I really came to understand at the front end of all of this is that most parents who children are on medication, they've been down that road. And the folks that have shown up in my clinics, that hasn't worked well for them.
Mm-hmm.
For whatever reason. And
Right.
it could be that there are a lot of people out there for whom this has been a blessing and
Mm-hmm.
it's working really well for them. And I can't speak to that. I
Mm-hmm.
speak to those parents and adults who have come in. They've been down the road of variations of medications. It works for a while, it wears off, or we give the medication in the morning to get him through school or her through school. They're
Mm-hmm.
home afterwards and just the tantrums break out, all the, because they've had to contain themselves so much at school just to try to get through the day. And then there's
Backlash.
kind of the backlash
Mm-hmm.
for the rest of the day and into the night or the weekends and such, or they won't give the medication over the weekend, or they take the child off of it in the summer. And there are some deep concerns about some of these medications. And I've been pretty clear about that in the book with all the research that's out there.
Mm-hmm.
Everything in my book is researched and referenced, so anyone can go find the original thought and piece there if you want to really understand what's happening with these meds.
Definitely on the same page with you there. So it seems like, all of these psych meds, if you didn't have a neurotransmitter imbalance before, you do now because they're creating them. So that's where side effects are coming from. Your body's going to compensate. So, and then eventually they'll stop working. You have to increase the dose. It's all of that. Absolutely. For sure.
It is all of that. And that's really what drives the addiction on the video gaming, which is what's so interesting is if these games are designed to do dopamine dumps, which they are, then the more a child or an adult, I have dads who are struggling as much as their children are in some cases. This is the brain then needing more and more of the fix of the dopamine. And the more that it gets from these external dumps that get created, the less the brain is going to make of its own, which then starts the difficulty of when you try to come off of these games, because now there is a withdrawal process for this. And it's going to take the brain a while to start reproducing the amount of dopamine that it really was capable of producing before it had these big dumps of it that were artificially raising the amount of dopamine in the brain.
Yeah, absolutely. So can you tell us maybe one or two or a couple of stories of people that have kind of had a transformation in this process?
Love to. I always think of one young man early on. I have two of them actually, but this young man, he was a teenager, and his dad called me one day knowing that I had started this clinic here in Southern California. I knew the dad, and he said his son had been in special education. He was in high school, but he had been in special ed most of his academic career. And that the day before, his son was sitting in the library at the high school and was really bored and decided to hack the school's computer system to change a grade.
Oh, no. Wow.
So, summarily, of course, there were some very big repercussions. And then when his dad brought him in, he was a very, very angry teenage boy, very angry. We did manage to get him through the assessment. He was willing to do that. He would follow his father's instructions fairly well. So there was still some respect there and willingness to kind of do what the father was asking. The parents were divorced. So that was probably the saving grace, is that the father still had enough connection there to, he may have been dragging him in literally by the collar, but he got him in the door.
Yeah.
And so we assessed him, and he certainly was by no far had the biggest impact of findings, but he had some significant impacts. in his life where it was very difficult for him to demonstrate his extreme knowledge and skill set because he couldn't perform in the ways the school was traditionally assessing children. So he couldn't demonstrate this. And he was so angry because of the failures that he had encountered. He was fighting with his peers all the time. He would get in fights on the school bus, get in fights in other situations. And so we did about 20 hours of neurofeedback training with him, and all of that went away. He started doing really well. He was moved to a different school, understandably so.
See that.
And the next year, he scored the highest in the school's history on the state math exam.
Oh, that's awesome. How cool.
And he used to joke about being the poster child for special ed.
Oh, bless his heart. That's so great. Very cool.
Yes, and I was doing a presentation to one of his parents' support groups one night, and he was there, and I was having some tech problems. And I looked at him and I said, "Can you help me with this?" He said, "Well, sure, of course." Right?
Wow.
So he was helping me with that, and I thought, I wonder. I just looked at him and I said, "Would you like to speak about your experience?" And he looked at me. It didn't take him a split second. And he said, "Yes, I would." And he literally got up there, stood next to me in front of this room full of parents, his parents on the front row. And he just said, "Let me tell you what my life was like before neurofeedback." And he described being angry, being in fights all the time. And then he said a line that just sent the chills through everyone in the audience. And he said, had it not been for this intervention, he would have either killed himself or someone else.
Wow. Jeez. Well, that's...
And the room, you could hear a pin drop.
Yeah.
And then he followed up and he said, "Now let me tell you what my life is like after now."
Oh, that's so
and
great.
He went on to say, about the state exam. So that's one. I have hundreds of these stories. And another one was a little girl, just as precious as she could be. And I actually had been out in the community doing a presentation to parents, and it was kind of a reading thing in the community. And it was my second presentation of the day. And I saw this little girl, little blonde hair, blue-eyed, little sweet looking little girl, maybe 6 or 7. She came to the front of the room and sat at the front of the room. She was accompanied by her grandmother, who sat at the back of the room. And so I actually was doing some demonstrations, and I had at those times I could use a laptop. I still have the capability of doing this. And I had a little headset that would measure brainwaves, and it just sat on the forefront of the measuring brainwaves from kind of the front here. And I usually gave the kiddos a chance to give it a try, and they could either blow up a barrel if they could attend well, or they could float a ball if they were in a calm brain state. So I had 2 or 3 of the little kiddos come through, and it was, maybe 10 minutes before I was ready to end. It was getting close to the end, and this little girl spoke up saying that she wanted to do it. I was like, "Oh, okay." So I hooked her up. Nothing would happen. She couldn't do anything with either one of these. She couldn't get it to go, and she was sitting there, and I gave her several minutes. I'm thinking, "Oh, this is tough." I said, "Well, how about if we, kind of move on?" "No." She said, "No, I know I can do this. I know I can do it." And so I thought, well, we're going to let her go here. And pretty soon she actually got enough attention going that she could blow up the barrel, and the entire room applauded. They all applauded her. Several months later, her grandmother showed up with her in tow, and then I got the backstory on this little girl. The grandmother was now a custodian. She had been abused in her early childhood. She had severe ADHD to the standpoint that in kindergarten, her kindergarten teacher told her she was going to quit teaching because of her.
Why would you say that to a child?
So this was how this little girl presented. I'm not going into the other details that the little girl shared with me that day, but it was one of those moments as a psychologist that it's a good thing I can have a pretty straight, not shocked face, but the details were significant for her. And so we started doing the neurofeedback with her. And I think we did at least 40 sessions with her, 20 hours. And the grandmother wrote to me, she wrote an email. She says, "I just want you to know," because this girl would have temper tantrums. She was on medication. It would wear off. She'd come home, and the grandmother described these temper tantrums as cataclysmic events daily. So she was inconsolable when this would happen, and it could go on for quite a long time. And so they went on vacation after we kind of finished her plan. And the grandmother wrote me an email. She goes, "Oh my gosh." She said, "I had forgotten her medication when we went on vacation. Once I discovered this, I nearly had a panic." She had a panic. She herself, she said, "Our vacation's going to be ruined because she's going to just have these meltdowns." And she said there wasn't a single meltdown the entire time. She was on no medication. Everyone had a pleasant time. And she said, "Do you think she needs the medication anymore?" And I said, "I would go have a conversation with your physician about that."
Oh, how awesome. Very cool.
Yes.
So what have I not asked you that you want to make sure you leave with our audience?
Well, I really believe that it's about understanding the neuroplasticity, which we talked a little bit about, but knowing that we have so much hope around this. And that's really the message I like to talk about. I think if parents are struggling with their children, one of the key factors here is I know some parents engage in some punishment or withdrawal kind of behaviors or those types of activities with children who are, quote, misbehaving. And one of the telltale signs about all of this is if those interventions are not yielding long-term lasting results, something isn't working. And so the wrong approach isn't going to lead to the right outcome.
Yeah.
And that's the key here. The wrong diagnosis isn't going to lead to the right intervention.
Right.
So you really need to know what you're dealing with. And I come from 25 years of teaching. My mother taught second grade for 32 years in the same classroom. My aunt was the dean of a college of education. Aunts and uncles were teachers and professors. So I understand the teaching world. Yeah. But I will say that we don't really understand what's happening here with children. And embarrassing children or, doing anything that you think it's going to motivate them from that standpoint isn't going to do it for these children. If they could do better, they would be. They're not seeking punishment on a daily basis. This isn't about the adults. Right. This is about this child, and the behaviors are a signal. They're language to be decoded. And if we can get this in the right, lineup here, so to speak, I think we're so driven to get rid of the behaviors. The behaviors are telling us something. And so if we can use this as kind of an investigation, it's like, well, what happens when I do this? What happens at school? What was the instruction? How was it delivered? What was the result? That may give you some insight into what this is. And up on my website, I do offer a free brief assessment that people can access there. You can also sign up for my newsletter. You get the first 3 chapters of the book for free for that. And I promise I'm not going to pummel your email box with lots of newsletters. But it's a way to kind of get in the door with this, because in the book, I have specific chapters on auditory processing with a long checklist of potential behaviors, the same with visual. And then there are children who actually have both of these, and they're a combination. And it's sometimes very difficult to kind of figure out what's really causing the difficulty here. But if we can understand those behaviors a little bit more, we actually have a better shot at giving the right support in the classroom and at home.
Yeah, that makes sense. So you kind of alluded to it, but if people want to find out more about you, your book, your clinics, where do they go?
It's all up on my website, which is my name, Connie, CONNIE, McReynolds, McReynolds.com. You can sign up there. The link to the book is actually on the front page. There are testimonials. There are also research articles that I've published on ADHD and on PTSD. So those are up there for those who need a snore at night. But there are some interesting graphs, so people might like the pictures. It depends on what you're drawn to. And in the book, there are a lot of examples of situations where children have come in and then what we've done. And I really wrote the book for parents and teachers, but applies to all ages. So our youngest has been 3 and our oldest has been 93.
Awesome.
And so we tackle everyone in between.
Yeah, very cool. That's great. Well, thank you so much, Dr. McReynolds. This is really inspiring. Thank you for sharing it.
Thank you so much for inviting me today. It's been a pleasure to be here.
Are you looking for a holistically minded healthcare practitioner who truly treats root cause rather than symptom suppression? Unfortunately, even in the alternative healing professions, this isn't a given. That's why I've created wholehealthdoctor.com, a resource to help connect patients to healthcare practitioners in their area who share a root cause philosophy. Alternatively, most of the practitioners listed also practice telehealth. So if there isn't anyone local to you, you can still find a great practitioner to help you regain optimal health. Go to wholehealthdoctor.com. That's wholehealthdr.com. Type in your location or just the specialty that you're looking for and find the practitioner who's right for you.
Thanks for listening to Christian Natural Health. This show is run by you, so please write in with topic and guest suggestions for future shows. For more great content, subscribe to Dr. Lauren's blog at www.drlaurendeville.com or follow her on Facebook or Twitter at Dr. Lauren DeVille. If you enjoyed the show, don't forget to share it with your friends and give us a 5-star rating in iTunes. It really helps us to stand out so other people can discover great content as well. Have a great week and God bless you.